What is it like for cancer patients living in poverty to obtain routine medical care? Poverty is associated with low education, inadequate social support and living conditions, unemployment, and risky behaviors. The risk of African American women dying from breast cancer is 41% higher than white women throughout the U.S. Barriers found among African American women seeking treatment consisted of mistrust of doctors in the U.S. health system, feeling like a guinea pig, the history of the Tuskegee syphilis study, maltreatment by race, and concerns about the harmful effects of exposure to pollution and toxins in their foods, neighborhoods, and workplaces. These concerns are consistent with studies that have found higher levels of local air pollutants and environmental toxins in low-income African American and Latino neighborhoods. The National Cancer Institute concluded that poor individuals are diagnosed with more advanced cancer and have lower rates of survival than those living in more affluent communities. A qualitative study reflected experiences of the urban poor with advanced cancer. They had concerns about housing, personal safety on dangerous streets and neighborhoods, transportation to appointments, limited money for medication co-payments, and healthcare systems that made them feel unwelcome. Lacking family support as well as having drug and alcohol problems were common in the urban poor. These participants reported feelings of behavior that were demeaning, insensitive, and dismissive from ancillary staff. In addition, individuals that were hospitalized reported feelings of frustration, being ignored, and neglect from nurses. Health insurance dictates what kind of medical care a patient receives, including cancer treatment. Individuals that perceive the lowest access to care are the uninsured or those with Medicaid. Not affording care was the most frequently reported reason for delaying medical care, tests, or treatments. Medicaid insurance payment rates to providers are also significantly lower than private insurance or Medicare. In the U.S., women with private health insurance or Medicare were more likely to receive better care than those with Medicaid programs or those uninsured. Women with Medicaid or uninsured were diagnosed later, waited longer for treatment, and had less access to treatment and were less likely to survive. Indigent patients were less likely than those with private insurance to undergo surgery for stage 1 through 2 non-small cell lung cancer, and less likely to undergo surgery or radiation-based therapy for stage 3. The risk of death was twice that of individuals with private insurance. African American men are diagnosed with prostate cancer up to 65% more frequently than Caucasians, and twice as likely to die from it. Contributing factors are lack of early diagnosis and treatment. Rural dwellers report less access and utilization of early cancer detection programs. Other factors are lack of trust with providers, past family health practices, and fear. Based on a retrospective cohort study between 2008 and 2016, many community cancer clinics closed. Increased travel distance to cancer treatment is associated with more advanced disease diagnosis, decreased use of recommended radiation, and higher mortality rates. Patients were more likely to be hospitalized locally with lack of specialized oncology providers. Reasons for local hospitalizations included difficulty with transportation, cost of travel, desire to be close to family or friends, or their overall health. Federally qualified health centers, or FQHCs, are funded by the Health Resources and Services Administration to provide preventive and primary healthcare services, including cancer screening to the most vulnerable populations. Ensuring these services are communicated to the underserved population is critical in eliminating cancer disparities.